autoimmune diseases, there's evidence that the immune system is just revved up. That's the best term I can use. Your immunoglobulins, which is used as a diagnostic test, are raised in your blood, and you often have these antibodies, which I'll discuss in a minute. And finally, it responds to drugs which suppress the immune system. Now, we're going to have a discussion about drugs a bit later, and I'm sure there is some concern about drugs. There's already been, the question is, are these really good for me or not? But there is no doubt that these drugs work. Let me just show you something. This is the kind of response we expect to see. This is the AST, which is the enzyme, which shows how inflamed the liver is, and this is the bilirubin, in red, which is inappropriately, it should be in yellow, because that's what makes you jaundice, yellow. And this is what we expect to happen. There's a dramatic response to steroid therapy in this condition. Usually. I'm not saying everybody, but usually. Okay? So this is why we think it's autoimmune. I should mention in passing, there are 3 big autoimmune liver diseases: autoimmune hepatitis, primary biliary cirrhosis, and primary sclerosing cholangitis. And some people have a bit of both, or more than one. And again, there may be people in this audience who have... the term overlap is used. I actually don't like the term overlap, because I think you actually have one disease or you don't. Now, what so-called autoimmune hepatitis, primary biliary cirrhosis overlap means actually people have the 2 diseases, right? Right. This is a little bit confusing. People in the 1960s, when the first trials were started, used to call this chronic active hepatitis. But that's a very non-specific term, and it was not until actually the late 60s that they discovered the hepatitis B virus and were able to test for it. Up till then, all hepatitis, chronic hepatitis, was lumped in together. In fact, if you read the initial trials on so-called autoimmune hepatitis, there were a couple who had hepatitis B. And despite that, there was a dramatic improvement in the... so that in the 80s, they used the term autoimmune chronic active hepatitis. And then, of course, they discovered hepatitis C, and that was obviously removed. There's been recently an international diagnostics, well, actually not that recently now, about 10, 15 years ago, and we use the term autoimmune hepatitis now. We've lost the term chronic, and this is important, because it's sometimes really acute. You become very ill and go yellow. It's that acute.